This year's football season brings attention to protecting players at all levels from experiencing a concussion. And Dr. Karlin, the director of the Oxford Concussion Management Program, joins us now with more this morning and some tips for you. Good morning.
Good morning. Thanks for having me.
Welcome. What happens when someone experiences a concussion?
Well, so the analogy I like to use with a concussion, first of all, it's a type of traumatic brain injury. So it's a hit to the head or the body, and that force injures the brain. But I like to think of it as that old-time telephone switchboard operator. They have to put the pegs in to connect the different phone calls, and that switchboard gets hit and those pegs get knocked out. However long it takes that operator to put those pegs back in, put them in the right holes, and reestablish those connections, that's kind of what happens to the injury to the brain. It's not actually something you're going to see on a CAT scan, but it's an injury to the wiring of the brain.
Okay, so that's a really important point. You don't see something. So let's talk about symptoms, especially for parents who have kids that are, playing football and whatever else. What are the symptoms they should look for that something's wrong?
Sure. There's four main groups of symptoms that you see with concussions. The first are physical signs and symptoms, things like headache, nausea, vomiting, lightheadedness, dizziness, light hurting your eyes, sound hurting your head, balance problems. Then you can have cognitive changes, trouble with memory, trouble with word finding, slowed reaction time, processing speed, feeling mentally difficulty paying attention and concentrating in school. And then the two that people don't remember a lot are the emotional changes. Kids are normally pretty even keel. All of a sudden they're happy, sad, angry, glad, changing their emotions, irritable, short fuse. And then lastly, sleep disruption. Kids who are normally good sleepers having trouble falling asleep, or they're waking up multiple times through the night, or they're tired, fatigued all the time. And the important thing to remember is those things might not happen immediately. They can come on a day or two after the hit. Yeah,
that's what I was going to ask you. If immediately as you walk off the field or the court, would you notice that immediately? And you say no.
Yeah, a lot of times you do. But if you're an athletic trainer or a parent and you're watching these kids, or a coach, and you're concerned that they took a pretty big hit, it's going to be important to keep an eye on them for the next 24 to 72 hours to see if they start having any of those symptoms.
Let's talk about recovery. Let's talk about treatment, the steps to take and recovering from that.
Sure. Well, we've learned a lot about concussions in the past 10 to 15 years. We treat them very differently than, say, when you and I were kids. And one of the important things that we've realized is it's very individualized. No two concussions are going to be alike. It depends on which one of those pegs get knocked out and how that operator inside that kid's head is functioning to put them back. Most importantly, we take an individualized approach, and you want to rest these kids. It's not just physical rest, not just no running and jumping and playing, but it's cognitive rest. TV, computer, video games, texting, telephone, homework, iPod, iPhone, all that stuff. That's like flexing your brain muscle, and that needs to be rested too. So we generally say 30 minutes on, 30 minutes off as a general rule.
Okay, so we always stress, and doctors like yourself stress, to wear protective gear. What kind of injury would it be? Give me an example, because some people may think it's like falling backwards very hard and slamming your head against something. The types of injuries that can lead to a concussion, what could happen while you're playing?
It's a wide variety. Like I said, it can be very commonly what you might see in a sport like football is a head-to-head collision, okay? A helmeted head-to-head collision. But it could just be them getting tackled in their body, a motor vehicle collision, which the head gets snapped forward and back. Anything that jars the brain, if it does not necessarily be a direct hit to the head. The analogy that I use there is if you take a raw egg and you shake it hard enough, you can break the yolk inside. So that's kind of like that yolk in there. It's kind of like that brain of yours. And either a direct hit to that shell or even just getting it shook around enough can injure it and injure those neurons.
Yeah, that's a really good analogy, because when you think of the yolk inside of an egg and how gentle and fragile it is.
Absolutely.
And if you think of your brain like that, it really makes you pause and say, I've got to be really careful.
Yeah, no, absolutely. And it hits home the fact that just because you're wearing a helmet playing football, for example, that's not necessarily going to protect you. Proper tackling mechanics, not shooting yourself off like a spear trying to tackle people, that's more important technique, and that's something that we're trying to really push forward for the coaches in the high school and junior high level to prepare these kids to tackle correctly, because that helmet isn't going to necessarily protect you from a concussion.
Okay, thank you so much. Some really good tips this morning as we start the season with a lot of football players out there.
Should be interesting.
The pros and the kids as well.